Hi, my name is Omida Gadola, and today I'm going to be talking to you guys about mental health. Defining mental health and various psychological disorders has always been a challenge for psychiatrists and psychologists, and it's been a challenge because certain behaviors are viewed as problematic in some cultures and non-problematic in other cultures, and these behaviors are what determines one's mental health. However, a leading journal in medicine from BMJ defined mental health as a state of being that includes the biological, psychological, or social factors which contribute to an individual's mental state and ability to function within the environment. Culture also plays a role in one's mental health. An example of this is in cultural bound syndromes. These are psychological symptoms that appear to be greatly influenced by certain cultural factors, and they occur less often in some cultures and more often in other cultures. Some examples of these cultural bound syndromes are Koro, Amok, and Frigophobia. Also, psychiatry has developed in the Western hemisphere of the world more than other regions, and they've come up with some universal mental health conditions. Some of these consist of depression, which is a temporary feeling of sadness, futility, and loss of energy after a loss of some sort. It can last for long periods of time for some people, depending on the loss that they've experienced. Also, social anxiety disorder is a fear of acting in an unacceptable manner that will lead to devastating social consequences, and schizophrenia, which is when someone has significant amounts of delusions, hallucinations, disorganized speech, disorganized behavior, loss of speech, and other things. This graph shows the rate of suicides per 100,000 people with various mental health conditions, and in the graph it shows that the US has about 15 to 20% for most age groups. Experiences of mental illness also vary between cultures, so the treatments also vary. One example is social support, which is when emotional assistance and encouragement is received from others. Also, psychotherapy is used, which originated from Sigmund Freud, and this believed that if someone talked to a trained therapist, it'll help face their fears of tragic memories and experiences better. Thank you for listening to this presentation about mental health.